Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor who sees a lot of knee pain patients, this particular article just completely is in line with what I see in practice. And so, first of all, we always need to talk. I have patients all the time coming into me telling me that they have bone-on-bone arthritis, and they have to have their knee replaced. And then 6 visits later, they don't have any pain and they've indefinitely canceled their knee replacement. We obviously didn't fix the arthritis, but that wasn't what was causing the pain. And I cannot drive this fact home in that just because we see something in imaging does not mean that it is causing the problem. There was a study I always bring up on MRI, and they looked at patients with knee pain and they looked at patients without knee pain. And the ones with knee pain, like 96% of them had abnormalities on MRI. And so you're like, see, that proves it. The people that didn't have knee pain, it was like 88%. You couldn't look at an MRI and say that person was going to have knee pain and that person was not. It is not that clear cut. And I will tell you that the structures around the knee, the fascia, the muscles, the ligaments, all of those play a much larger role in knee pain than does the joint surfaces. It certainly gets to a point where a knee replacement is really our only option, but there are a tremendous amount of things that we can do beforehand. That has to do with movement, that has to do with finding a practitioner that knows how to address the soft tissues. I wouldn't say never, but very rarely work on strengthening the knee. That's usually not the issue. It's getting the soft tissues balanced and then having the patient do movement, activity, exercise, especially leg strengthening. So those things are all really important for recovering. And then we can look at things like PRP or PRF or even stem cell that can be very helpful for knee pain when they're done along with other treatments. PRP, PRF, stem cell, they are not a standalone treatment. If you're going to go to a clinic that you're going to spend $5,000 for stem cells and they're not talking about doing other things, you need to turn around and run because by itself, it is not an effective measure. That being said, it brings us back to this particular study. And they looked at, ultimately in the study, it was 566 people, average age 63 years of age, 11 years of follow-up, and they looked at the dietary inflammatory index. You can, without going into the specifics, you know what is an inflammatory diet. It's a processed Western style diet. Those with a higher dietary inflammatory index were 20% more likely to report moderate knee pain versus minimal or no knee pain. Interestingly enough, and this is not a terribly big surprise, the dietary inflammatory index didn't have much to do with the actual arthritis. Back to what I was saying at the beginning, not very rarely is the joint, I don't say very rarely, but typically the joint surface is not the problem. This just drives home, even though the researchers are like, we have no idea how this happened, it makes complete sense in that all those structures around the knee are very related to the amount of inflammation, the amount of movement we do, the soft tissues, and not the joint surface. So when the researchers were stumped that the dietary inflammatory index didn't have as much of a relationship to the arthritis, in my world, that makes complete sense, especially given what we see in our office. So the take-home message from this is that diet absolutely plays a role in inflammation and the pain that we feel everywhere, not just the knee. And if you have knee pain, find a practitioner who knows how to treat the soft tissues around the knee. Just strengthening the knee is not going to be enough. So I can't stress that enough, especially given how many cases we've seen with knee pain and the really fast results we have with people, even if they have bone-on-bone arthritis. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.